78 Americans die every day from opioid overdoses. Many become addicted after a doctor prescribes the drugs for a medical condition. Denise joins us with more on how hospitals are responding to this crisis. Denise?
Well, Jessica, Anne Arundel Health System just completed a study on how opioid drugs are prescribed. What they found concerned them and is leading to change. More than 1,000 people a day are treated in emergency rooms for misusing opioid drugs. In Baltimore, the opioid fentanyl, 100 times more potent than heroin, is a killer.
There are more people dying from overdose here in Baltimore City than there are dying from homicide.
I believe this qualifies for epidemic.
An epidemic that many times begins when a doctor legitimately writes a prescription. But there are no national guidelines as to how much to prescribe for which procedure. Anne Arundel Health System's task force surveyed doctors and found some were prescribing 10 times more than another for the same procedure. So they started a program to cut prescription doses and look for alternatives to fighting pain.
The patients have appreciated the extra effort towards their own safety and can tolerate much less opioid than we used to prescribe.
Since 1999, sales of opioid drugs quadrupled in the U.S., as did deaths from overdose. Anne Arundel's pilot program led to a 40% reduction in overall opioid prescription from January to July.
At the same time, recognizing that opioids are one of the most important and helpful class of drugs ever invented. So we're trying to thread a needle here, and I think so far we've had some success.
Now, many other hospitals and medical systems in this state are also working to establish opioid guidelines. Realizing it's a problem they helped create. Jess?
Denise, thank you. Ultimately, Anne Arundel Health System's goal is to reduce opioid prescriptions by 50% over the next 2 years.